Hello, everybody. Hallo zusammen. Today we have Dr. Natalie Phillips with us. Wir haben die Dr. Natalie Phillips bei uns in der Show. And I was so excited to get to know you because actually it was your show that I liked so much, and I watch you on LinkedIn live, and I thought this is such a great, I would say, way to show your knowledge and to share it with your communities there, so that I just copied it. And it was me that asked you what software do you use for that. You and Dr. Galloway, you are such a great team. I enjoy it very much. I'm
Thank you.
always looking forward to see the next episode. So it's great to have you with us. Thank you for taking the time. For those, I just speak German, okay, to introduce you a little bit. Also für die es nicht wissen, die Natalie Phillips ist eine Audiologin in der Nähe von Colorado, hat sie ihre Klinik. Und ich habe sie auf LinkedIn schon lange verfolgt, und sie wird uns heute ein bisschen den amerikanischen Markt erklären. Und sie hat auch eine sehr interessante Vita, finde ich, und da gehen wir heute drauf ein. So you understood everything?
Yep, I did. Totally got everything.
I just introduced you and said that I follow you on LinkedIn, and then you can explain us the US market and how everything works over there, and that you have a very interesting CV. Maybe we can start with getting to know you a little bit better. And by the way, you were the colleague that helped me with my application at Sellers University. Do you remember that?
Yeah, I do remember.
So now I'm in the master's program.
Yay! Awesome.
Yay! I'm now in the second quarter.
Very
and
cool.
I learn of a lot of stuff that we don't learn in our apprenticeship in Germany. And I'm very, very happy to do that. Yes, I'm blessed. But let's start with you, Natalie. I know that you grew up in Hawaii. So when did you decide to come over to the other 50 states of America?
Yes, yeah.
Can you tell me about that?
Yeah, absolutely. So first of all, thank you for having me and for spending the time to really highlight what we're doing. And let's see. So I grew up in Hawaii, but I went to school in Colorado for my undergraduate and did my 4 years there, did 2 years back in Hawaii for my master's degree program, did my clinical fellowship year out there. And then I had to work 5 years before I went back for my doctorate in audiology. And so came back to Hawaii for my master's degree and got married to my husband, who I met in Colorado. And then we moved all over. So after we got married and I did my fellowship year, then we moved to Texas. We lived in California. We lived in Oregon. We lived in Washington.
Wow.
And then we moved back to Colorado. So a couple of different states throughout our marriage. And I was lucky to be in different settings for audiology, from setting up newborn hearing screening programs to private practice, to working for nonprofits, to working with ear, nose, and throat physicians, to clinics. And so I got kind of a wide range. Yeah. So I settled down and worked with an ENT for many years until I just opened our own private practice with Dr. Galloway here in Fort Collins, Colorado. Not even a year. In November is when we opened our doors, November of 2021. And that's how we started in our own new private practice in Colorado.
You and Dr. Galloway, you are business partners.
Yep.
Okay, you open it together.
Yes.
Okay.
Yeah.
That's very interesting, because I see that there are a lot of women also working in the audiology industry. It's the same like in Germany over here. I would say, I estimate like 2/3 of the hearing care professionals are ladies, female over here. And I think it's the same over in the US, isn't it?
Yeah, it's close to about, you say 2/3. I want to say closer to 80% maybe on our
Wow.
side. I don't even think it's as high as 90%. I'm not too sure though. So somebody can correct me if they're watching. But it is primarily female, I was going to say run, but female audiologists that are practicing.
But
Yeah.
it's such a technical, I would say, industry or
Mhm.
profession. Um, Maybe there's more social to it, or I don't know why it's so female dominated. On the other hand, the most companies in Germany are all owned by males. I
Mm.
don't know how it is in the States, but I think I would say another 2/3 are owned by men over here, even
Oh,
though we have
interesting.
more females.
That is very interesting. Yeah, and to go to your question, it is interesting. However, I do feel that audiologists on the whole, whether they're male or female, are very organized. Type A. It's a very low stress job, very medical, and entrepreneurship, right, is also a piece of it. But then also the service and caring part of it. So even though you mentioned the technical side of it, there's
Mhm,
so much more, and we love taking care of our patients. And
mhm,
so I think that it is pretty flexible for especially females in our position. And I would almost venture, but I could be wrong again because I don't know the stats. But I would almost venture to say that a lot of women, more women than men even, own their practices only because of the population of audiologists here in the
mhm,
US. But I could be wrong again, but I'm pretty sure that more women own
mhm.
their practices and own their businesses than men, because we're just primarily a female um, populated uh, type of occupation, I should say. So, yeah. So it might be a little bit different. Yeah.
So we have a comment from Michaela Ender. She is watching the show and vielen Dank, Michaela, dass du zuschaust. um, I learned a word during my studies, and it is caregivers.
Mhm.
Caregivers, and I didn't know that one. And I think it's exact. It's like it's a bullseye, or how do you? I would say so. It's caregivers. We don't have this word in Germany over here.
Hmm.
So
Interesting.
yeah, yeah,
Yeah, and
and
like
I
I
like
said,
it actually.
when people talk about hearing instruments or, hearing aids, then you think of the technology, you think of more of that technical component. However, when you say audiology, and for me,
Mhm,
the way that I explain my profession and my occupation is not that, hey, I do hearing tests and fit hearing aids. No, to me, it's the connection piece. And so I'm a connector, right? I
mhm,
love to be able to connect people back to their life and back to their loved ones. So it's a little
mhm,
bit more, it's a lot more than the technical piece and just fitting hearing aids. But we're
mhm,
looking at, I mean, Dr. Galloway and I in our practice, and I can only speak for us, but we're really looking at the whole picture of
mhm,
what's going on medically, what's going on socially, right, emotionally in your lives, and
mhm,
let's help you get that connection back
mhm,
to what's important to you. And yes, it starts at hearing, but there's a lot more than hearing that we counsel on in when we're seeing patients. So I think there's a lot more, and so caregiver makes a lot of sense when you
yeah,
say that,
it
because I
does.
feel like that's exactly what we do, is that we really provide that service and that care because we care about our patients, right? And so you've got that technical component that's fun for us because we get to dabble in all those different things and everything, but it really is taking care of our patients for sure.
So another comment. Thank you. It's interesting to hear you. Yeah, thank you for coming. Thorsten. Yeah, we are friends. Yes, so we have a different profession, I would say, because our profession is translated like hearing aid acoustician. We are not
Mm,
audiologists, so I'm the first one, as far as I know. Correct me, okay? Who's viewing? Um, if I'm wrong, but I'm the first guy who's studying clinical audiology. It's more like an apprenticeship, and we are more like specialized on fitting hearing aids.
mhm.
Um, And this is, so we are not allowed to diagnose any disease or disorder. And yes, and I'm very interested in diagnostics and electrophysiology. Okay, electrophysiology measurements. This is a tough one. This is a
Electrophysiology.
hard one.
Uh-huh.
Like ABRs
Mhm.
and so on, and APD. Next week I have APD a course in pediatrics, and this is a very interesting field for me. So I'm looking very much forward to it. And I had a course with vestibular disorders and the whole system. We
Ooh,
don't work with
exciting.
any balance problems in Germany over here. The system is like we have ENTs. We don't call them ENTs, not otologists or otolaryngologists, just ENTs. They do the diagnostics, and then they send the patient, and we don't call them patient because we are not audiologists. We call them client.
I
Send
see.
them to us, and we do the hearing aid fitting, and then we send them back to the ENT. He checks what we did, and then he like he signs that everything is okay, and then we can like charge the public health insurance.
I see.
Does that make sense?
Interesting. Yeah. Yeah. And, as you're talking about it, there's so much more in audiology. So I'm so excited that you get to take some of those courses as you're in this master's program. Because when I first started, I mean, even in our undergraduate, I had 2 audiology classes. And even at the end of my undergraduate degree, I thought, okay, I'm not too sure if I want to go to speech pathology or audiology. And it wasn't until my master's program. For me, I went through a master's program, did the fellowship year and then did the doctorate. Right now, after your undergraduate, like Dr. Galloway went through her 4 years of undergraduate, and then she went through 4 years of school to get her doctorate, like went right into the doctorate, where they have
8 years
Yep,
of studying,
yep.
8 years, very
Yeah.
expensive 8 years.
Well, but it's interesting because, that's where you really learn all the other things that you didn't have in your undergrad. So like what you said, everything you talked about, we do. And I love being that type of audiologist, right? And so we do balance. We work with the brain concussion specialists and head injuries, sports
Yes,
injuries.
I actually printed that out from your website. Yeah, I
Yeah,
studied
yeah,
it.
we love that because we get to see brain injuries. We get to work with them with tinnitus and sound sensitivity. We work with them with balance. We work with them with APD. We can offer cochlear implants, bone anchored hearing aids. I mean, you name it. And that's one of the
Yes,
things that
I
I
name
love.
it. I have to translate a little bit in the and because I don't think everybody understands what are you talking about. Also APD bedeutet Auditory Processing Disorder, was auf Deutsch heißt auditive Verarbeitungs- und Wahrnehmungsstörung. Genau. Okay, this is just APD explained and translated. And what do you do when you treat APD?
So first of all, a lot of our brain injury and concussion patients come over, and we're able to kind of see them for the wide gamut because sometimes they'll just have, they'll have normal hearing, but they complain that they can't hear well in noise, right? Or there's too much distractions or whatever it is. And that's what we're talking about with APD. There's a lot of, or auditory processing disorders. There's a lot of different things. Sometimes they have dizziness. And so we've got to test them for dizziness and get them to the right person to help with the type of dizziness if it's ear related. And then they've got tinnitus and sound sensitivity. So, we've got to look at everything. For APD right now, what we're doing, I don't know if you know Angela Alexander, but she has a
Yes.
great
I know
program,
her
right?
from LinkedIn also.
Yeah, apdsupport.com. And so, she's got this great program that they can sign up for and start doing it that way. So typically we have the patients work on it themselves. Sometimes it does help to have a mild gain hearing aid. And so we help with that because the actual circuitry of the hearing aid is going to be helpful for them that can get a little more direct audio input sometimes, or to get a little bit of help to get that sound to the brain faster. So sometimes it's a mild gain hearing aid, but those are typically what we suggest for auditory processing disorder.
Do you work with auditory training programs or
So with
hearing
that, right
programs?
now we're just having them work with Angela's program for the auditory
Okay.
training.
So maybe I will have to ask Alex What was your name? Alexander?
Angela Alexander.
Alexander, yeah.
Yeah.
Because her family name also is her first name. I confuse it all the time. Yes, you mentioned balance assessments. Tell us more about that, what you do.
Yeah. So typically we can do a couple of different assessments. And really what we're looking for is the ear related to your balance issues? Sometimes it could be eye related. Sometimes it's, being in a certain position. Sometimes it is cardiac related, it could be neurologically related. So we're really, when we're doing our testing and evaluation, ruling out if it's inner ear related. And so we do at least 3 different tests. One is an electrocochleogram test to look for high drops in the inner ear.
Yes,
We do
miniestheses.
a vestibular evoked.
I had a basic course.
Did you have it? Okay, good. Yeah.
Yeah.
So we have the VEMP, right? The CVEMP. And so we do that testing as well to look for superior canal dehiscence, which is a thinning of one of the semicircular canals that can cause different symptoms, but it is related to the ear. And then with our VNG system, we're able to do that testing to see if there's any core stability issues, positional issues, eye issues as well, to then refer to the proper referral for depending on what's going on.
Okay,
So
I think
there's
I
a lot
will
of
have to.
different tests.
I will have to translate in the meantime because I don't think they have. Our viewers have all the vocabulary for that. Also, es geht Schwindeldiagnostik und es ist so, ECOG ist also Electrocochleography, also auf Deutsch Elektrocochleographie. Ja, ist actually the same. Es ist sowas Ähnliches wie, also man misst sozusagen. Also ist auch eine elektronische Messung der Cochlea und man kann da eben man kann schauen, es ist sehr kompliziert. Da hat man SP and AB,
For the ratio of an
yes.
ECOG, yes, we look
Ja,
for
ja,
the
you
summating
have- also man
potential
hat-
and the action
Man hat
potential. Yeah.
dieses Verhältnis von dieser Welle, ist ziemlich kompliziert. Und da kann man eben dem Meniere Krankheit diagnostizieren. Mit dem VAMP kenne ich mich selber nicht so aus. Und what was the third test?
Video nystagmogram
Ja,
or
VNG
VNG.
ist Video, also dieses Nystagmus ist dieses Augenzittern. Das kennt, also wenn ihr fahrt mit dem Zug, ja, you go by train and then your eyes always go like, and this is the nystagmus. One, just to explain it a little bit, who does not have the basic course, I just have a very basic knowledge in it, but we don't learn anything about nystagmus when you fit hearing aids.
Right.
It's a different field. I just wanted to explain it, und die Augen haben eben sehr viel mit dem Schwindel zu tun, aber das ist wirklich ein riesiges Feld und ich habe da auch nur ein bisschen was drüber gelernt, 6 Wochen Kurs, es ist sehr kompliziert. Okay, I translated that.
But what's interesting? You said that you don't learn about nystagmus as much when you're fitting hearing aids. But I just wanted to point out also that sometimes when people do have this core stability that's off because of an accident or an injury or a virus or whatever it is, sometimes even hearing aids can help set that right too if they have a hearing loss with their imbalance or their nystagmus, the eye movements. And sometimes when you fit a hearing aid, you can kind of see that their balance gets a little bit better, especially if their hearing is off a little bit and it's asymmetrical. So it is kind of important to still, learn about some balance issues and some of the testing that can be done for sure.
So maybe I can bring that to Germany. We'll see. Yes, so we have this. Then we have, we mentioned this, and we mentioned your clinic. I just looked it up where you are exactly. Just really northern of Denver. I would say maybe is it 50 to 100 miles?
It's about 45 to 50 miles from Denver.
Yeah. Check this out. Your story and then the surfer girl because you're born in Hawaii. I thought this would be nice.
Yes, I love it. I use that emoji. I love it.
So it's very interesting with the dizziness and lightheadedness. I learned this vocabulary. I had never heard of this before. Yeah, I know vertigo is like when you go spinning, and I heard a podcast. I think there are, I would say, 20 audiology podcasts over there in the States, and I think I subscribe to everyone.
Oh, that's awesome. Yeah, I think one of the really good podcasts, and I don't know if you subscribe to this one yet. I'm going to give my friend a shout out here. Craig Casper, who is in New York, and he has New York Balance. He has a New York Balance clinic. He does a lot of great podcasts surrounding dizziness and balance. And so that might be something, if you don't subscribe to that one yet, look up the New York Hearing and Balance, and it's Craig Casper, but he has a great podcast about that. That's one of his specialties.
Can you text this later on to me so that I don't forget?
Absolutely.
Great.
Yep.
There was an interesting saying. I would say it's a saying, and the doctor, I really forgot his name. He said to say everybody is talking like too soft or too like, you know what I mean? Not correct enough. And it's like to say when you have vertigo, everybody is spinning around me. They are running in circles around me. So I thought, so you just you're not seeing that you caused, that that your ears are the problem. Everybody, it's the fault of everybody else, not your own. And this was an interesting, I would say, relation. I just wanted to mention that.
Yeah.
Yes, I think this topic is very important or very interesting to our German viewers because the markets are so different. So there are just hearing care professionals, the acousticians in Germany, who sell hearing aids. And as far I know, you have hearing aid dispensers, you have Costco, and then you have hearing instrument specialists, you have audiologists, and you have the VA. So, did I forget anything?
Okay, yeah, but things kind of overlap a little bit. So, okay, so when you talk about who can work with patients that have hearing loss, okay, you're looking at audiologists, and you're looking at hearing aid dispensers slash hearing instrument specialists okay, so there's kind of two. Well, let's add a third one in. Okay, so then there's audiologists, there's hearing aid dispensers and hearing instrument specialists, and then you've also got audiology assistants now. So those are three different almost professions that you could go into, right, if you wanted to work with people that have hearing loss or ear-related issues. It depends on the type of ear-related issue would be your scope of practice, right? But let's say you were interested and you were moving over to the US and you were interested in the ears. Technically, you have four because you've got the ENTs too, right? So you've got four different professions that you can go into.
Correct,
yeah, so those are the different professions, okay? Then when you talk about Costco or the VA, those are going to be places where you can let's expand that. So if we talk about places that you can obtain, let's just say hearing aids. That's it, just hearing aids, okay? Then you can go to Costco, you can go to the VA, you can go to private practice, you can go to clinics, hospitals, okay? So there's lots of different ways that you can obtain hearing aids. If you don't need hearing aid, I mean, if you take hearing aids out of the actual thing, and you want to have other ear-related issues, then you take out really Costco. Costco's really only the hearing aid place, right? Because then if you've got balance issues, tinnitus, sound sensitivity, cochlear implants, all of these other types of things, you still have the VA, you still have private practice, you still have clinics, you still have hospitals. And so those are different places that you can get other things besides hearing aids. But at Costco, you can have an audiologist work with you, or you can have a hearing aid dispenser or hearing instrument specialist work with you. So both are employed at Costco. It depends on who actually is hired there. So that's where it differs from, you had said VA and Costco, and then you had audiologists, hearing aid dispensers. Well, you had two places and maybe two different professions. But so that's kind of how it works in the market here, and it would be the hearing market versus the hearing aid market, because hearing aid market, you can get it at multiple different places.
But VA is just for veterans from the military.
Yes, correct. Yep. You'd have to submit papers and make sure that you're approved, and then you obtain a certain level of benefits to obtain hearing aids, cochlear implants, whatever it is, tinnitus therapy at the VA.
Do they pay for hearing aids, the VA, or do they charge you like extra when you are?
From what I know of, if you qualify, then you are covered for benefits, including hearing aids. Yep, at the VA.
Okay, great.
So to the veteran, you might as well go to the VA if you got benefits, because you served our country, and you can get hearing aids there. And there are some excellent audiologists at the VA.
Yes, I saw our professor sent us a list of the salaries when you work at the VA, and it's okay. What is the difference between a clinic and a private practice? It
depends. So a private practice obviously would be owned. Let's say we're talking about private practice for audiology. So it would be owned by the audiologist, right? I mean, you could be in a private practice with a physician too, and that's still a private practice technically. Clinics, I would say, would be more maybe even corporate healthcare. Sometimes clinics would have maybe multiple specialties, including probably primary care. So you could be like, let's just talk about my experience. So I was at a clinic in Washington, in Seattle, and it was called the Polyclinic, right? So poly meaning multiple providers. Yeah. So the Polyclinic had about 200 providers, from primary care to specialties to audiology to whatever. So that was actually a pretty big clinic. It wasn't a hospital, but it's considered a clinic. Sometimes clinics can be like 8 providers or 10 providers, in California, I was with more of a hospital because I was at the UC Irvine Medical Center. So it was more of a hospital. I was in the department of ear, nose, and throat and audiology. So the Department of Otolaryngology and Audiology. That was a hospital setting though. So they had, obviously people that would check in and stay over, births, things like that. So it's a little bit larger as a hospital setting. So clinics can be different sizes. Private practice, you could have multiple private practices. We know audiologists who have obtained multiple private practices. Sometimes it's exchanged, as they're my clinics, they're my private practices, whatever. So sometimes private practice, the words private practice can also be exchanged for clinics too, because they're obtaining private practices or clinics. Okay. So sometimes there's not a difference for some people.
You mentioned tinnitus treatment. How do you treat it, tinnitus?
Oh, I love that. Okay. So I love helping people with their tinnitus and sound sensitivity. So I was trained by Dr. Yastreboff, probably a good 25 years ago, maybe 23, 24 years ago. And so I actually use sound therapy. And so it's based on the neurophysiological model of sound, that the tinnitus is there because of the perception of sound. And so what we're trying to do with sound therapy is to desensitize or habituate the brain that has this perception of sound, to get it to be where it's not as noticeable. So awareness, we're trying to change awareness, and we're trying to change disturbance of the tinnitus. And so really, based on the neurophysiological model of tinnitus, yes, tinnitus starts in the ear, but once it becomes more where it's lingering, and it's not just about detecting it and letting it go out the door, but it's, people are spending more time, a higher level of brain activity monitoring it. And there's an emotional association, there's physiological things that are happening. Then we actually have to do something to change that. So for example, if you think about in Germany, let me ask you, what side of the car do you drive on?
We drive on the right side of the street, or what do you mean?
And then what about the car? If you're in the car, is it on the left side or on the right side that you drive?
Steering wheel is on the left side.
Okay, so you're like us.
The same system.
Okay, so it's just same like us, but some countries are opposite, right? They
Yeah,
even
like
Japan is
England, New
the right
Zealand,
side. Yeah.
Australia.
Right. And so when you're used to something like that, okay, let's say you're going to go to a country that drives on the opposite side of the car and on the opposite side of the street, right? You can study the manual the whole time on the airplane as you're getting to that country and think, okay, I got to remember I got to be on this side of the car and I got to be on this side of the street. I have to turn this way. But it's not until you get in there and your responses are now sending different signals to your brain to have your brain reorganized. After about a day or two, you're fine driving in that other country, but you
Yeah.
can't just keep staring at it, right? So it's just like tinnitus too. I can't tell you, oh, you know what, Max, like don't pay attention to your tinnitus. Just tell yourself 10 times, don't pay attention
Yeah.
to it. It doesn't work like that. We physically have to do something so that it changes the way the brain works in order to retrain or desensitize you to tinnitus. So that's what I do. I do sound therapy to desensitize or habituate people to their tinnitus, to change that perception of what their brain is doing to that particular sound. So it's been around since the 1980s. Has about an 86% success rate in reducing tinnitus awareness and disturbance. And within that protocol, I'm also able to help sound sensitivity issues by defining and figuring out what type of sound sensitivity the patient has, and then also use sound therapy to help them retrain their brain for that as well. So it's
Okay.
basically a retraining of the brain using sound therapy would be my 2 cent answer.
It's very interesting because there are so many ways of treating tinnitus. And I just wanted to know your way, yeah, your method. What do you think of teleaudiology? Do you do that?
Yeah, so there's a couple of different things that I was thinking about here. So, because of COVID, a lot of manufacturers came out with this excellent way that we can still take care of patients so that they don't have to come into the office, right? There are ways that we can turn on things in hearing aids, have them wear something around their neck. We can do a audiology appointment where you can make adjustments to the hearing aids, whatever it is. So we have done a few options like that. I also have lots of patients that fly in to see me for tinnitus. And so I
I think
counsel
so,
them
yeah.
over Zoom. I counsel them over, kind of like a teleaudiology visit. Obviously,
I
it's
think this
hard.
is very interesting
Mhm.
to do the first or second or maybe all the sessions via remote softwares, yeah.
Yep.
Because just flying over for one appointment for half an hour, where you
Mhm.
ask the same questions as you would ask via
Yep.
Zoom,
Mhm.
is saving a lot of money and time for everybody.
Oh, absolutely. And I can see it for hearing aids. I can see it for cochlear implants, things that we only need the software to be connected. And we can do it that way. But if you're doing diagnostics and you're doing benchmarking, if you are doing that, there's no way. I don't see how we can do that part of
Mhm,
our
mhm,
job
mhm.
to really service the patients that way. Yet, anyway, right? Yet.
I think for the most hearing care professionals, they are very busy in the like daily based assessments and hearing
Mhm.
aid fittings. For them, it's a hard time to focus on another new technology like teleaudiology.
Mm.
So it's increasing in Germany, the
Mhm.
sessions, but only I think slowly. Yeah,
Yeah, I think you're right. I think here as well. I think that
okay.
people did a lot of it during COVID and, a little bit less now, but it's still a great option to have.
Yeah, but to do it in COVID, you first have to install the app and to tell the patient how the app is
Yeah,
working.
you have to almost like turn it on in the fitting. So you have
Yeah,
to,
so
yeah,
I
yeah.
think the patient has to come over anyway.
Mhm, mhm,
So yeah, but it's for me, it's a very interesting field as well as telemedicine as a
mhm,
whole. Yet I just wanted to hear your opinion. I recognized that American audiologists were very nervous, I would say, in the last 1 or 2 years when these over-the-counter hearing aid it was not quite sure how it's going to be in the future. I always read articles in here on Hearing Tracker and so on So, are you not you are you audiologists over there in the States still a little bit insecure or nervous, and when it comes to OTC products?
That's such an interesting question because I don't know if it's really about initially I think there was a lot of reactions about being nervous that oh my goodness, we're going to go out of business or whatever
Mhm,
it is. I know that there are a handful of audiologists as well that were saying, "Hey, wait a minute, don't freak out, like there's a place for this." Because in the grand scheme of things, people have to hear better. And if this is their entryway to get into what we
mhm,
do, right? Then let's accept this and let's provide this at our practices. And so I feel that those were probably some of the initial types of reactions. Now, as we're watching the market, which is kind of interesting, we're finding out that our hearing aid manufacturers are doing a great job. They're like 2, 3 years down the line doing research and development on things that are going to be released 2 to 3 years later, right? And so
mhm,
they're doing their job. They know what we as audiologists see, what patients need. And so what I think that we're seeing too with some of these over-the-counter devices is that these are not hearing aid manufacturers per se, but they're people that hey, there's something that I'm wearing in my ear, whether it's a healthable or a wearable. Let's turn this in to maybe amplify a little bit. And so
mhm,
some of them aren't as successful because people are not using them for that as much, right? Or maybe they're failing they're not getting that research that manufacturers for years have been working on. So I feel like I still think that there's a place for them because again, there's so many people out there that are not getting the help they need for hearing
mhm,
loss
mhm.
that if they put something on that helps them and it makes them happy,
Better than
again, that
nothing. Yeah.
steps back, right? You just have to step back and say, "Hey, it's working for them. Great." And when they need me or when they kind of get to the limits of whatever that's going to be doing, they'll find me, right? There's
Mhm,
so many people out there that are not getting the help. And
mhm,
so I think that over the counter now, we don't carry them in our office, but I know that a lot of audiologists do carry them in their office as
mhm,
kind of that entry point, right? To try to
mhm.
get into something.
So I think we as hearing care professionals all over the world, we have the same problem. We are
Mhm.
selling technique that nobody wants. Nobody wakes up in the morning says, "I want the latest hearing aids now. Today, there's nothing more interesting than go and buy hearing aids." So they are just coming because they need to. After 7 years
Mhm.
of torture, then there is one moment, then they say, "Okay, I can't take this any longer, I need help."
Yeah.
But actually, nobody wants hearing aid, and I think this is the first step to get something close to a hearing aid.
Mhm.
Is like just human.
Right, right. But I have to kind of beg to differ a little bit because I think that that starts with us, right? That starts with programs like yours. That starts with programs like ours. That's educational. I think more of us need to get out there to educate the public, right? Because you're
Mhm,
right. Nobody wakes up and says, I'm going to go get a hearing aid because I'm struggling here, right? Like you don't think of that. But why is that? Because we're not talking about it as much.
mhm,
And so, a lot of people can talk about it more, can talk about more of their good experiences. I think a lot of people remember people complaining about hearing aids. I mean, I've been in the profession long enough where, oh my goodness, like when I first started, there were 2 digital devices that were out there. Everything else was like turn your finger,
Was it Siemens?
to
Siemens
adjust it and
Prisma? And
yeah.
Widex. I think Widex and Siemens started with digital
Oh,
hearing
see,
aids. Can you
no,
remember that?
for us, it was 3M. I think it was 3M and Resound. Those were the
This
first
one.
2
Okay.
digital hearing aids that I was exposed to. Mhm.
Okay.
Yeah, it was crazy. Yeah. So, I think that I do agree, although I do agree that people are not really wanting or waking up in the morning thinking about getting a set of hearing aids. I think that we have to do with a lot of that, right? Is to really continue to talk about it, to have educational shows about it, to have people share things out that talk about it. Because I'm telling you, the technology, I swear, every time new technology comes out, I would always say to myself, yeah, how is that going to be better for them? There's no way because this already works really good for them. And sure enough, that new product does, right? And so it's really interesting because I think that I stopped saying that because like I said, hearing aid manufacturers are really doing their job to get hearing aids to work better for people. Every year that we're doing this job, and I think that with the way hearing aids are going to be, healthables, to have some different options, it's really appealing to more and more people because of the technology, because it makes their life easier, because there are other things that hearing aids are going to be able to do. Like I still put hearing aids on. Let's just say last week I had a 17-year-old just as excited to try new hearing aids. He had hearing aids all his life, but he had entry level hearing aids. I put some new ones on that connected to his phone, and his eyes lit up just as much as I had a 70-year-old, that was the same way. I showed him how to use things on his phone. His eyes just lit up, right? And so
Mhm.
I think that we are reaching the masses little by little, but the more that there are people talking about it and sharing these shows and sharing these educational opportunities with people, I think that it's going to slowly get better, right? Nothing's ever too quick, but I think that it will continue to get better, that people will start to know, hey, did you know that I even had hearing aids on, at a dinner party? They're like, no, I didn't even see them, right? Tell me more about them. And they'll be talking more about their good experiences versus, oh my gosh, my hearing aids are squealing, or I still can't hear you, or whatever it is. But as long as we take that responsibility to educate our patients, whether it's due to their type of hearing loss or due to the type of circuitries that are out there, I think that that's super important, so that the expectations are managed with people. And then when you fit people correctly and they love them, then they talk about them more, right?
Mhm. Yeah, yeah. Do you also say, what's a Schublade is a drawer where you put things in? Is it a drawer? So we
We
say
call it a
drawer,
drawer.
drawer hearing aids because they don't wear them, they just put them in the drawer. So
Yep.
like not
Yep,
very
and that's what I
very
tell my patients. When we sit down and do a hearing aid consult, we do a communication needs assessment, and we're also looking at their environments, looking at their support systems, right? And so it's not just like, oh, I see your hearing loss, let's put this hearing aid on. No, there's a whole amount of stuff in between that we want to do. We do a cognitive screen on them, right? We talk to them about where they, if they had hearing aids, what did they like and what they did they not like? I said, because if you were my patient and sitting in front of me, I'd say, because I would rather you not purchase hearing aids and stick them in a drawer than wear them. Like if you're going to get hearing aids from me, you're going to wear them. I'm going to keep you accountable. It's accountability partner, right? I will keep you accountable by having you come in. We'll make sure everything's a fit. Having you come in for a check here, having you come in for another check here. I want to make sure that you are using these how they're supposed to be using it, and not wasting your insurance money or not wasting your money wearing something
Mhm.
that, or not wearing something, and you're just sticking it in the drawer. So I make that very clear to people. But when you do a very comprehensive consult and evaluation process after the hearing test, this is after the hearing test, right?
Mhm.
Then you're able to look at some of these different issues that they might have to try to get them to help them, educate them to pick the best hearing aid possible.
Mhm.
So,
Mhm.
I mean, that's really the goal, right? Is to get them, because if you have another positive opportunity to share their testimony with, it's not even just to put it out on social media, but with their own family and friends, then you've done your job.
Mhm.
So that's really what it's all about.
One of my last question is, do you have a special way of fitting hearing aids? You know what I mean? Like, do you choose NAL, NL2, or like this DSL V5? Or is there anything like you prefer? Or tell us about that. What's your favorite way of fitting hearing aids?
So I'm going to back it up and be a little more broad. So what you're talking about is the fitting formula, and
Mhm,
typically we stay with the NAL NL2. Okay, because that's just kind of what manufacturers are suggesting. Unless it's a pediatric patient, then we
mhm,
do the DSL, right?
mhm,
But again, it defaults because you have to put their age in, unless the manufacturer has some kind of proprietary fitting formula that we go
mhm,
with. And so that's the fitting formula. But to back up a little bit to talk about how do we fit hearing aids,
Mhm.
typically what we do is when we fit hearing aids, most manufacturers, because of their algorithms, I kind of just go with their first fit first. And then I kind of sit and talk with the patient and I say, okay, I said, tell me what it sounds like. I make different sounds, different noises, right? I click my pen, I rattle some paper, I talk over my rattling of paper, and I'm talking to them about how things are sounding. And what I do is, even though the first fit may be a certain way, I make it comfortable for them at that first fit. And so
Mhm.
I say, okay, I don't care about the target. Yes, I get this fitting formula, everything like that. But I
Mhm.
want to make sure that when you leave my office today at the first fit, that it's comfortable. Now,
Okay.
comfortable doesn't mean that when you see me in a week, it's going to be comfortable. You might, as far as I know, you might come back, throw them at me and say, oh, it was super loud when I left you the last time. Now I can't hear anything, right? I said, because
Mhm.
the one wild card in the whole
Mhm.
fitting process is your brain. I do
Mhm.
not know how your brain is going to adapt to what we're doing. So let's make it comfortable today, but just know that I might have to make some adjustments the next time you see me and then the next time, right? And so, again, teaching them more about the brain and how it's functioning, right? Teaching them
Mhm.
how the brain is going to adapt. So I want you
Mhm.
to wear them your waking hours. I want you to take them out when you retire for the evening. I don't want you to just wear them when you go out at night, right? So really counseling them, teaching them about that. Now with the
Mhm.
fit, when they come back, we usually schedule a 1 week, a 2 week, and a 4 week. We also do real ear measurements. So we make sure that they are fit appropriately based on their ear canal resonance.
Mhm.
But then we also do aided testing. So making sure that they're functionally fit properly. So we sometimes wait till they're fit. So at the 4 week appointment is when we do some of that testing as well to make sure that once they settle into what they like, then that's when we test them, their verification testing. And that's typically how I do the fitting.
Okay.
Hopefully that helps.
Thank you for sharing that with us, because there are so many ways and there are so many opinions. And like when somebody has one opinion, at least this is how I see it, he's not able to see other methods
Mhm.
or different opinions. And
True.
this is why I always think about how is he doing it or she, or what is there another way? And it's very interesting to learn about special methods from colleagues who have a lot of experience. Yes. So you answered all my questions. Thank you very much for your time.
Well, thank you for
How,
having
when
me.
somebody wants to contact you, how can he, she do it?
I think the best way would probably just be my email address or our website as well. But my email address would be N for Natalie Phillips at audiologycenternoco.com. But that probably would be the easiest. Yeah. If you have any other questions or, you want to reach out, that would be great.
So when somebody wants to contact me, I talk German now, okay? Am besten über Instagram, über @neues hören. Ganz einfach, da könnt ihr mir eure Direct Message schreiben. Am einfachsten über Instagram, bitte. Ich freue mich über jede Anregung, über jeden Kommentar. So, I would say we wrap it up, or we wrapped it up. Just stay with me for 1 minute.
Mhm.
And to our viewers, thank you oder vielen Dank fürs Zuschauen. Wir sehen uns in der nächsten Sendung. Alles klar. Thank you, Natalie, and stay with me for a minute.